The decision to develop and revise the health sector disaster plan came after consultations held last week with representation from 22 stakeholders. Osbert Charles, Head Disaster Management Officer in the Ministry of Health, says stakeholders were presented with developed roles and responsibilities looking at the three phases of the disaster cycle. Phase 1 addressed the planning and preparedness stages. Phase 2 looks at a response during and immediately after an impact, and Phase 3, recovery and restoring services. The draft plan should be completed by the end of May, with a plan in hand by this year's end. Reviews will be carried out to ensure that the plan discussed at the consultation are implemented. According to Charles, the highest stage following the review is seeking approval from the policy team and cabinet.
They would leave with a good understanding of what is expected of them. Having completed the parent plan, the various divisions and departments are now expected. We'll be giving them a common framework that they can work with, and they will be going to the various departments and developing that plan. So in that plan, key would be the word multi-hazard plan. Whereas before it was just like more or less a hurricane plan, key in each of the plans moving forward will be the word multi-hazard.
He gives this assurance to the public.
To let the public know that despite the fact that we are planning, we still have the existing plan that we are using, and they can feel confident that should something happen, the health sector is well poised to respond. Because our objective here is to provide prompt, appropriate and effective responses in the event of disasters and emergencies, with the overall goal being to reduce pain and suffering and to prevent or minimize the loss of lives.
One participant sees this as beneficial to the Ministry of Health and thinks it should have been held earlier based on its relevance.
In the past, we had a disaster plan, but it was more hurricane oriented. But now we have updated, we are in the process of updating this plan now to make it a multi-hazard plan, meaning responding to all hazards, as it relates, health response to any hazard, all right?
Christelina John, GBN News.